After a traumatic experience, it's normal to feel frightened, sad, anxious, and disconnected. But if that feeling doesn't fade away and you feel stuck with a constant sense of danger and painful memories, you may be suffering from post-traumatic stress disorder, or PTSD as it's commonly known. With me today is Dr. Liz Legg, who's a psychiatrist at UCT, and Dr. Darren Green. Welcome to Doctor's Orders.
Thank you very much.
So Liz, what's the definition of post-traumatic stress disorder?
Well, as you said, PTSD is a mental illness that happens after someone experiences a very traumatic event. So typical examples are an assault, a rape, and also constant things like war.
And Darren, what are the signs and symptoms of PTSD?
They generally complain of a feeling or a sensation of impending doom. They feel that they're going to actually die. They feel also that they can't escape from the situation that they've been placed in, but also they also fear that they are reliving the trauma that they've experienced. So that in itself gives you a fight or flight response every single time, whether this happens in your sleep, whether it happens in your thought processes, or a trigger that you just witness while watching a television program, or even just being in a social gathering where a memory is triggered. So a fast heart rate is often associated with it as well, sweating profusely from that sympathetic response. And then you find nightmares often being also quite a big part of it.
What's also interesting, what you're talking about is the hyperarousal. So the whole autonomic system is very aroused. And often some of those symptoms can be that the person's much more irritable and they don't notice. So for friends and family, the person's more irritable, they're more explosive, they're more touchy, they're more edgy, which is often very out of character. And you can trace it back to the fact that they're actually just
touchy,
on
edge.
And what about the crippling effect? I mean, some people can also present, I suppose, not in a hyperarousal state, but also probably a bit paralyzed by the trauma, where they actually feel like they can't move and can't continue to do anything.
Exactly.
And any trigger can set this off.
And the last thing, because it's also very interesting, people who are constantly exposed to trauma often have what's called emotional numbing. So one of the other things with PTSD is that people avoid the trigger, so the things that you're talking about that set them off, they avoid that. And one of the things that can set them off is their own feelings, so they become emotionally cut off. And the family will pick that up. The person's not emotional with them anymore, not connected to them anymore.
In a country where crime and tragedy dominates our news on a daily basis, PTSD is a common problem. We take a look at the prevalence of the condition in South Africa.
In South Africa, PTSD is common, owing to high rates of violent crimes, including physical and sexual assault, hijacking and domestic violence. In studies in youth and in patients attending clinics, rates of PTSD of around 20% have been documented. About 8% of men and 20% of women exposed to at least one traumatic event will develop PTSD in their lifetime. The greatest concern is that many people don't realize the seriousness of PTSD, and many don't seek professional help until the condition has advanced so far that it has begun to negatively affect their lives.
So let's talk treatment of post-traumatic stress disorder. What are the various forms of treatment?
Well, treatment can be done on a biological basis and on a psychological basis. From a biological perspective, we use what are commonly known as antidepressants. So the most common antidepressant that we use is something called an SSRI, and it's a very good medication for this particular problem. You do need to give it a chance to work. You do need to push it up to the correct doses. And other medications that are useful are benzodiazepines, which is things like Valium and Ativan, which can be taken when the person's feeling particularly anxious. So you don't want to take something like that every single day, but when you're going into a feared situation or you feel your anxiety going up, it's better to take something, get rid of the anxiety, and then kind of move on so you feel that you've coped with it.
Do you have to always start with the medical interventions, or can you go directly into psychological?
Very much depends on the severity of the problem. So you'll find, in most cases, I'd suggest a psychological intervention first, but you're going to find some people whose anxiety and symptoms are so bad that they actually can't tolerate the therapy, and they're going to get so anxious in the session that they can't do anything and they can't use it, in which case you want to medicate first.
Why would that be?
Well, there are a few conditions that we need to look at before actually referring someone for any form of psychotherapy, but particularly cognitive behavioral therapy or CBT, you need a patient that's motivated, that's willing to participate in the program itself. You'd go and revisit, for example, the things that formed the pillars or the structures in your thought paradigms, and then you'd go and look at why they actually formed in that way and look at where you can change some of them. You know, you can work on your interpretation of those thoughts, and cognitive behavioral therapy is centered very much around going to and understanding and revisiting those thought processes.
Just to add into that, so the C is cognitive, the B is behavior.
Yes.
And specifically in PTSD, you need to do exposures, okay?
Yes,
exposures are the behavioral component of CBT. And if you're looking at someone with PTSD, they have a lot of avoidance. So part of the CBT is to expose someone to the feared stimulus, which obviously is going to be anxiety provoking. You know, so if someone is really anxious, again, we can use medication to help them. But I think bear in mind the exposures are done very, very gradually.
You wouldn't simulate a robbery.
No, but you see, they would be avoiding that particular, you know, so they might, instead of taking 5 minutes to drive to work, they're taking half an hour because they're too scared to drive past that point.
Yes.
And that's where their functioning is being impaired. So you wouldn't immediately take them to that point, but you might say, you know, imagine going there, you know, and you relax them while you do it, and you give them, certain things to visualize. It helps their body to relax, and eventually you can take them to that place with you, so that it's a supervised experience.
I think the functionality is the most important thing, because everybody can identify with all these symptoms. For sure. I mean, as humans, we identify with paranoia, we identify with being startled, as just these symptoms are experienced to such a degree that it affects how you live.
And look, there's a line. I mean, we live in a country where there is violence, there is crime. You know, we have to have alarms and precautions and all that kind of thing. So where is the boundary between a normal precaution and a hyper-arousal anxiety? And I suppose that's different for different people.
And is there any association with substance abuse?
Definitely, because you'll find a lot of people, you know, they don't know what these symptoms are. They're having these horrible feelings, feeling anxious, not being able to sleep. And what do people often do? They self-medicate. So I'm sure you see a lot of that in the emergency room.
Yes, I think waking up in the middle of the night and you know, trying to just numb the pain or trying to forget about it, people try to sedate themselves for a longer period of time. So they combine things like alcohol and medication.
It's somewhat ironic that people working primary healthcare, such as paramedics, are quite susceptible to PTSD. Let's look at some of the other professions where the risk is high for post-traumatic stress disorder.
With an estimated 90% of physically injured police officers suffering from post-traumatic stress disorder, the SAPS is very aware of the high incidence of the syndrome affecting its force.
You know, after attending all these things, it's like when you go home, you can just go straight to your bed. You feel not talking to, not even watching the TV. You really take some part of that incident with you to home. Every time when you hear of something happening, even if it's not your police station, that thing that you've attended, similar to that one, it comes back.
Paramedics are also at high risk for PTSD as they work long hours and are constantly exposed to gruesome scenes. ER24 takes special measures to protect them.
Our EMS personnel are at higher risk of getting PTSD because they are exposed to harsh and violent situations every day in their work environment. Most EMS personnel, in fact, hide the symptoms of post-traumatic stress disorder. We have a number of programs in place to avoid PTSD. The first is to diffuse the immediate situation on scene, so to debrief our paramedics immediately after the incident. The second is to do a formal debriefing about 72 hours later. We also have a health and wellness program where they can speak to a social worker. We're very fortunate in that we have a team of trauma counsellors who are available. They assist in debriefing all our staff in the acute setting.
We salute the brave men and women in our police force and emergency response services who risk their lives and their well-being to help others on a daily basis.
Now, PTSD must affect the family members and friends. Could you chat a little bit about that?
Friends and family, I think, need to understand that the person's potentially going through something and that they might not realize themselves and that they need the support and possibly a suggestion that they see someone and talk about it.
As well. How can they help?
Well, the sufferer themselves also need to understand that it's not normal to wake up with nightmares so frequently and to be crippled that you have no functionality at work. So you also need to know not to isolate yourself, which is something they often do as well. They try and hide the symptoms and signs. So, you know, if your family and friends don't notice it, or your colleagues at work don't notice it, certainly you as the sufferer yourself might also want to know the warning signs.
SADAG is a very useful resource,
Yes,
South African Depression and Anxiety Group. They've got a helpline, and from that you can give them a call and they can kind of direct you to something appropriate.
Thank you so much for a very, very interesting discussion.
Thank you.
Weighing on a topic that affects so many of our citizens. I know you or someone you know could be suffering from PTSD, so please speak up and seek help.